Okay.
Hi, my name is Gene David. I'm a respiratory student at Miami-Dade Medical Campus. My objective today is to show you how to provide tracheal care using an aseptic technique by removing the old dressing, cleaning the area, and replace all adjuncts. But before, we have to just do a pre and a post patient assessment to ensure patient airway patency. I will just walk into the room by introducing myself to the patient, explain the patient what the procedure is gonna be. From there, I will just move and just wash my hands with a set of gloves on, and I will just come back, and basically I'm supposed to have my PPE, my gowns, and my mask with a visor to protect me against fluid. But for the purpose of this video, I will not have the mask with the visor. I will have my gowns on. I will bring the bed down to make sure I'm very comfortable just doing what I'm about to do. I have gloves on. I will just start assessing my patient. The patient is not coughing. If the patient was coughing, I will just go ahead and suction the patient. From there, I will just put my get my pulse ox, put my pulse ox on the patient, and look at the monitor, and that will cover me for heart rate or to sat, and I will do a full bilateral breath sound, and I will check I will check my 4 quadrant, just in and out, right?
We're gonna check that.
Right, just in and out, just all 4 quadrants, and the patient is bilateral clear, and I'm just gonna go ahead and proceed with my procedure. I will just start get my equipment ready. This is my trach care kit, right? This is my 50-50 hydrogen peroxide mixed with sterile water. I will check my expiration date on that before I start. I will just grab the chart, look at the patient armband, medical record, date of birth, and name. Make sure everything matches. But basically, you do not need an order to do trach care. Trach care is done PRN and shiftly, but you should check with your hospital protocol to know exactly how to go about that. I will just I have gloves on, and I will just put a towel on the patient's chest, bring the bed down, bring the rail bed down, and this is my trach care kit. I'll open that. Inside of it, I have 3 compartments. One of them will be a mixture of the hydrogen peroxide and sterile water. The other 2 will just have sterile water in them. I will just carefully take my drips out. That's a sheet. I can establish a sterile fill, and right here, right? Establish my sterile fill right here, right? And I'm gonna go take my trach kit and pour everything right here without touching anything. My 50-50 mixture would go right here, and the other 2 will have sterile water in them. And I'm gonna put my tracheal cap on the side, and I'm gonna remove the inner cannula. Just turn counterclock, take it out, put the oxygen back, and put my inner cannula in the mixture. From there, I will go sterile, right? Sterile. This is my gloves right here. Carefully taking that out and open that in a sterile way. Take that in a sterile way. We'll just go ahead and dress my dominant hand first. Carefully take this out like that. very small gloves. Just get it from the inside right there. Gonna go in. Alright, so got my sterile gloves on. I'll just go ahead, bring my table closer. Okay. Bring my table closer here. I grab my inner cannula. There is a brush that comes in the kit. Alright, I'm gonna keep it low down. Brush my inner cannula, take all the debris and dry mucus out, in and out. Right? Then keep it down, put it in my water again, and leave the brush right here, and move towards the patient. I'm gonna put the tray collar on the side, and remove the old dressing. Right? Remove the old dressing. Once I remove the old dressing, I'm gonna get one Q-tips and dip it into the sterile water, clean in and out, in and out, and take the older Q-tips in the water again, clean the plates, right? Clean the plates, right? And put the oxygen back again. I'm gonna grab my inner cannula. I have 4x4, sterile 4x4 here. Dry it, take all the debris out. Right? Make sure it's completely clean. And I'm gonna insert my inner cannula. 9 o'clock, come down 6 o'clock. Clockwise until you hit a click. Right? Until you hit a click, it's secure. Now, I'm just gonna go ahead, remove my tray strap. Constantly having one hand holding the tray, remove the trap by just taking one side out at a time. Right? And I'm gonna put the new one right here. Turn it around the patient neck, and now I can move it because I have it tight on one side. So now I can put the other one. Alright, but make sure we don't put it too tight because I should be able to put 2 fingers under it. Now I'm gonna put my old dressing, just replace it. I'm gonna put a brand new one. I'm gonna loosen it up a little bit, right? Bring it inside, and be able to bring my dressing under that. Okay, and secure it, tidy it a little bit, but still I'm able to put 2 fingers under that. Okay. Now I'm just gonna go ahead, reassess my patient. I'm gonna do just check the ultrasound, check the heart rate, check the breath sounds. Right. I'm gonna clean the area, get everything out. Okay. And bring the bed down. Put the rail up. Right? Make sure the patient is comfortable, and this will end my trach care demonstration.